Hello, and welcome. Today we're diving into the world of gallstones, a common and often painful condition affecting the digestive system. We'll explore what they are, why they form, how they're diagnosed, and what can be done to treat them. So, let's get started. The million-dollar question: what causes these pesky gallstones to form? The answer lies in the composition of bile, a digestive fluid produced by the liver and stored in the gallbladder. Gallstones typically develop when there's an imbalance in the substances that make up bile, most commonly cholesterol. Too much cholesterol, not enough bile salts to dissolve it, or an excess of bilirubin can all contribute to the formation of these hard deposits. Other risk factors include genetics, certain medical conditions like diabetes, and rapid weight loss. Essentially, it's a complex interplay of factors that can disrupt the delicate balance within the gallbladder. Let's talk pathophysiology, which essentially means how it all goes wrong. When bile becomes overly concentrated with cholesterol or other substances, these substances can begin to crystallize. Over time, these crystals clump together, forming small stones. These stones can then grow in size and number, potentially blocking the bile ducts that carry bile from the gallbladder to the small intestine. This blockage is what triggers the characteristic pain and symptoms associated with gallstones. The gallbladder, struggling to push bile through the obstructed ducts, contracts forcefully, causing intense abdominal pain. Gallstones are surprisingly common. Epidemiology studies estimate that up to 10–15% of adults in the United States will develop gallstones at some point in their lives. Certain populations are at higher risk, including women, people over the age of 40, those with a family history of gallstones, and individuals of Native American or Hispanic descent. Obesity, rapid weight loss, and certain medications can also increase the likelihood of developing this condition. Alright, let's talk symptoms. Many people with gallstones are actually asymptomatic, meaning they don't experience any noticeable problems. These silent gallstones may only be discovered during routine medical imaging for other reasons. However, when symptoms do occur, they can be quite dramatic. The classic symptom is a sudden, intense pain in the upper right abdomen, often after eating a fatty meal. This pain, known as biliary colic, can last from a few minutes to several hours. Other symptoms may include nausea, vomiting, indigestion, and pain radiating to the back or right shoulder. If a gallstone blocks the common bile duct, it can lead to jaundice, a yellowing of the skin and eyes. So, how do doctors figure out if you have gallstones? The primary diagnostic tool is an abdominal ultrasound. This non-invasive imaging technique uses sound waves to create pictures of the gallbladder and bile ducts, allowing doctors to visualize any gallstones present. In some cases, other imaging tests like a CT scan or MRI may be used. A HEDA scan, which tracks the flow of bile, can also be helpful in diagnosing gallbladder problems. Blood tests can help rule out other conditions and assess liver function. Gallstones are often classified by their composition. The most common type is cholesterol stones, which are primarily made of cholesterol. Pigment stones, on the other hand, are composed of bilirubin, a waste product from the breakdown of red blood cells. Mixed stones contain a combination of cholesterol, bilirubin, and other substances. Understanding the type of gallstones can sometimes influence treatment decisions. Now, let's talk treatment. The best approach depends on the severity of the symptoms and the size and location of the gallstones. For asymptomatic gallstones, often no treatment is needed. However, for symptomatic gallstones, several options are available. The most common treatment is surgical removal of the gallbladder, a procedure called cholecystectomy. This can be done laparoscopically, using small incisions and specialized instruments, or through open surgery. Another option, less commonly used, is oral medication to dissolve the gallstones, but this can take months or years and isn't always effective. In some cases, endoscopic procedures can be used to remove stones from the bile ducts. Can you prevent gallstones? While there's no foolproof way to guarantee you'll never develop them, there are steps you can take to reduce your risk. Maintaining a healthy weight, eating a balanced diet rich in fruits, vegetables, and whole grains, and avoiding rapid weight loss are all good strategies. Regular exercise can also help. Some research suggests that consuming coffee may also offer some protection against gallstone formation. The prognosis for people with gallstones is generally good, especially after cholecystectomy. Most people experience significant relief from their symptoms after surgery and can live normal, healthy lives without a gallbladder. Recent research is focusing on less invasive methods for treating gallstones, such as using shock waves to break up the stones, extracorporeal shock wave lithotripsy. Scientists are also investigating new medications that can prevent gallstone formation. Thanks for joining us on this exploration of gallstones. We hope this information has been helpful.